process of that, I started training for my first half marathon. And while I was training for it, I kept having issues with my hip because I tried PT, chiropractor, a couple of different PTs, combination of PT and chiropractor. What this condition does is cause a whole host of compensation issues because of the pain that I was having in my hip. And the recovery from the surgery has kind of furthered that. What's been the best tool for me has been this quad baller. It has helped me get into that flexor and TFL, which I discovered were really restricting my motions. And the most important thing is to breathe. If you sit and hold your breath, you're not releasing those muscles, and you want to be able to relax those muscles as much as possible, even though you're in pain. I work on the piriformis. I use the balls a lot, and I use lacrosse balls prior to getting this kit, but one thing that I found is working is actually using this little like rollerblade wheel type part to roll back and forth in this area. And what it kind of does is, versus working on a specific trigger point spot, it allows me to just kind of roll it back and forth. So I put that, I sit on it, and I make sure that the little wheel is right in that piriformis area, kind of off to the side, and roll up and down. And where this also gets into where I can't really get at with the ball is right in the area where the femur and the hip kind of come together. I end up getting some pretty tight muscles right in there. I've tried everything. I've tried all different types of foam rollers, to the knobby kind, like that look like torture devices, to PVC pipe, and this quad baller has just, I think part of it's the shape of it. It just really has worked really well for me. What my routine has been pretty much daily for the last 6 weeks or so, and it's made a huge difference, especially right here in this hip area. Because if I don't do it for a couple of days, I will start to notice, especially if I've been driving, which I do a lot of driving. So the last couple of weeks I started working out at the gym again, which it's been a very slow recovery. I'm 3.5 months post-op right now. So I plan to work really hard throughout the winter to keep my glute max firing and to keep these muscles really loose and not firing when they're not supposed to, in hopes of being able to do Grandma's half marathon here in Duluth, Minnesota next summer.